Guys, Dave Man Max 6 or Muscle Insider, and this is Ask the Doc number 2. Dr. Rand, how are you?
Good, how you doing?
Great. Thanks for having us again. I want to say a huge thank you from me and from all of the fans all over the world. Show number 1 was a hit, man. Everybody likes you. They think you're the coolest doc around, and it was great. Thank you for doing that.
No, thanks for having me. I appreciate it, and I'm happy to do it.
That's awesome. So today, actually, the first episode was actually some of my personal questions that I had, because it was the first one, obviously. But already, the questions have been pouring in since the past 2 weeks, and I've got questions from all over the world. From all different ages. I even have women who wants to send me some questions, so that's great. We're gonna have a wide variety of questions from different people, and that's exactly what we wanted. So we're gonna start right away with question number 1. This person says, I've been naturally bodybuilding since the age of 18 and I'm now 31 years old. I was wondering, at what age do men start getting lower testosterone? Is it typically mid-20s, or is it a male that has been bodybuilding naturally for his entire life, keep going at his level? Are they higher? Are they higher a little longer? So if someone's doing bodybuilding naturally for many years, does he have better chance to keep his natural level higher longer? I think the question is, and also when typically it starts going down.
Well, the first part of the question about when
at
does
what
testosterone
age
typically start to decrease?
Right.
It depends on which study you read, of course, but generally speaking, I think it's accepted that around about 30 years old, your testosterone naturally starts to decline. I believe the estimate is about 1% a year, but that's so varied. And that's part of what makes medicine fun. Everybody's different, and I know that sounds like an escape from the question, but it really isn't. You have to take each individual separately and look at the numbers. I think we talked a little bit about this last week. It's not just numbers. They have to have the symptoms. So
right.
I don't mean to, again, avoid the question. So technically, I think the answer is, again, depending on what study you read, 1% a year after age 30, but...
So on paper, that's usually what...
Yeah, but more importantly, the symptoms can occur anytime. A lot of the symptoms are brought on by stress. I think that's a big factor that we haven't studied enough of. There's eustress, the kind that's good for you, like going to the gym and working out, and there's the bad stress, where you're worried about the
bills.
2.3 kids getting through college, and the mortgage payment and all that stuff. That drives the testosterone downward for sure.
That's a good point. So the earlier you start stressing, the more chance you have for your test to go down the tube earlier on.
Yeah, absolutely. Now, that having been said, I've seen people with low testosterone in their late 20s. I think the record I have without an actual disease process going on is 27.
Oh my God.
But I see guys in their late 50s. I want to say the record I have is 59, that still have very high levels of total and free testosterone. Those are both extremes.
That's interesting. And I've always thought, for some reason, in my head, 35 was when everything was starting to go downhill, but it could be younger.
In my experience, I tell people roughly at 35,
things
start to go south.
Okay.
And a lot of people come in at 35 wondering what's going on.
Gotcha.
The problem is, if stress is a big factor, well, obviously I can't tell people, well, just stop stressing. That puts more stress on them than before. And the issue becomes, okay, well, you can move to an island and, say or do your yoga on a daily basis and your mantras and whatnot, and maybe get your test levels back up for, the next 5 years?
Yeah. And
then you're more likely to be naturally, if you will, in need of testosterone replacement therapy. So, it's a catch-22. Is that practical? Heck no. We live in Los Angeles here anyway, and in a different world.
Highly stressed environment.
So, it's practically speaking, that's about when it occurs, is age 35, that I see clinically.
Okay. And so would you, as far as natural bodybuilding is concerned versus enhanced, do you say that these guys that have been bodybuilding natural all their life, and they are in early 30s or mid-30s, have a higher chance to have higher tests naturally than the other enhanced?
That's another interesting question, because the myth, if you will, is that, first of all, athletes have higher levels of testosterone. That could be true, but what I see mostly these days, and it probably goes into that stress I was talking about, the pressure to achieve, it's so much more competitive these days.
Yes.
Most of the athletes overtrain, and so they actually have lower levels of testosterone.
Because they're doing too
and
much,
in the sports that involve endurance, it doesn't necessarily reflect in their performance because, and this isn't to be taken the wrong way, but certainly females have lower levels of testosterone,
Mm-hmm.
and yet they can compete in endurance sports without a problem.
Mm-hmm.
At any rate, I see low testosterone often in athletes, particularly who overtrain, but in terms of the natural versus not natural,
Mm-hmm.
certainly when you're using replacement therapy and you go off of replacement therapy, there will be a period at which during which your testosterone is lower. It's usually
Gotcha.
for about 3 months, and your pituitary kicks back in. And
Gotcha.
really, that's not the hard part. The testicles take a little bit longer to kick in, and you'll have temporarily lower levels of testosterone. But for those guys that cycled, particularly when they were younger, typically
Mm-hmm.
before age 26, when you're still developing, sometimes that will, for the rest of your life, lower your testosterone levels overall because
I see.
you haven't been fully developed while taking a replacement. Even if you're good at cycling and faking the body out, you might go for 12 weeks, and before your testosterone levels completely shut down or shut down for that long, you go off of your testosterone cycle, or in a lot of cases, obviously steroid cycles, and you can bounce back. But again, while you're developing, there's a lot of chance for permanent damage.
And that's
To make
what's
it sound
important.
horrible, but-
Yeah, no, but it's important. It's important to say that. Okay, very cool. All right, Doc. Question number 2, I asked the doc, what are the signs of low T? I guess this person says we didn't cover that enough last time. Okay. Is there anything that we should try first before HRT? And do you know any good doctor in Oklahoma? So any sign of low T?
I can
what
start
are
with the
those?
last part
Okay.
quickly. No, I don't know any doctors in Oklahoma,
Okay.
but these days it's worth a shot with your primary care physician because awareness of low testosterone is increasing. So it's worth a chance, and you can always, if you can find a good doctor, he or she should be open to studying this. If they haven't already, you can bring information to the doc, and if they are not already up to snuff, you can educate them and hopefully get something going in with your local doc. And it's not, I know we're laughing because of Oklahoma, but no, it should be everywhere.
Yeah.
But I know we have a lot more fitness-oriented people here
Right.
than in Oklahoma, and we're going to get letters from Oklahoma now. But obviously different lifestyles and whatnot, so
Yeah.
it's not meant to be.
Like it's not a big deal to talk about that in Cali. It seems like every other person you talk to. Oh yeah.
A lot of people move here
Yeah.
because of Hollywood, all that stuff. Anyway,
Yeah.
so we don't mean to be putting down Oklahoma, but I get the point of his
Okay.
question, I hope, and he gets mine.
So signs of low T.
Signs of low T are pretty easy. Lack of energy, lack of libido, lack of a general sense of just well-being and joie de vivre.
Mm.
Someone can be depressed if they have low testosterone. Someone can complain of what typically comes out as fogginess in thinking.
Sleep, I think you mentioned before.
Sleep is also an issue because of that lack of sense of well-being. People will sleep for the first 4-hour cycle, and then when they have enough energy to start worrying again, they will, and the wheels start turning at 2 or 3 in the morning. Whenever a guy will typically get up to urinate, and they can't go back to sleep because they just don't feel like, hey, I can conquer that. Remember when you were 16, if you got up in the middle of the night to urinate, and your brain started going that direction, you say, shut up, I'll handle it in the morning, because you were superhuman back then. You had that sense of, hey, I can do anything.
Yeah.
So those are typical signs, plus change of body composition.
Gotcha.
There's a reason why guys are using testosterone in athletics, because we know that it helps support the creation of muscle. Anabolism is important. So guys tend to start getting more fat and losing some of the muscle, which of course comes hand in hand.
Yeah, and you're not too happy when that happens, which
That
creates
adds
stress.
to
it's all connected.
Downward spiral.
Okay, and then what was the second part of the question? I don't remember. So is there anything? Oh, is there anything to try first before someone may consider a hormone? Do you have anything that?
Well, other than trying to reduce stress, like we talked about.
Yeah. I think he's talking
If
about.
someone's younger, I will look to. Well, first of all, we have to rule out a problem.
Right.
Which is fairly rare, but it has shown up several times in my practice. You could have a pituitary adenoma, or a microadenoma, something that interferes with the signal from the pituitary to the testicles, the luteinizing hormone that the pituitary would be creating, and that happens we expect we want to check that, excuse me, in younger people because for a myriad of reasons. Obviously, we don't want to start replacement therapy if we have another answer to the problem. And if someone is younger than 30 years old at least, I will investigate that avenue first through an MRI and rule out something blocking. And by the way, it's typically a non-cancerous. It's a benign tumor, but it is something that gets in the way, obviously. And it's an easy surgery. They're all surgeries, but relatively easy to go up through the roof of the mouth, typically, and remove the tumor, and normal functions restored. But in guys older than 30, there aren't a whole lot of things we can do because the testicles just don't respond. I can go into a lot of different reasons as to why I think that is, evolution being part of it. I mean, well, I will. 200 years ago, or 300 years ago, the life expectancy average was about 28 years old.
Wow.
What's the purpose of having functional testicles if procreation is not on the table, if you will?
Right.
If you didn't have a child by the time you were 14, 15,
wow,
it wasn't going to make it, right?
Wow.
If you made it to typical average life expectancy.
Yeah.
So anyway, bottom line is, we would have tried, and we do, again, if someone's young enough where we think the testicles respond, and we've confirmed that it's an issue of the pituitary not functioning rather than the testicles not functioning, we'll use human chorionic gonadotropin, HCG, which is an analog of LH, luteinizing hormone, to get those testicles to work. Otherwise, we find in clinical practice that HCG just doesn't bring up the level of production enough to make a clinical difference, so we go straight to replacement therapy.
Gotcha. Thank you. This is actually a good one. It's actually from an older gentleman who's actually out of state as well. This one is from another country, and he says, for a guy around 50 who's in decent shape, like a
gentleman. I'm 52.
He said, for a guy around 50 who's in decent shape, like a doc himself, with 100 milligrams of testo gel a day, which is the test gel, in those little pack, normally be a good dose to feel like 30 again. And he says in parentheses, only 10% gets absorbed via the skin. So what do you think about that?
100 milligrams of a gel is not going to do the trick.
No.
I used to have the farm reps come around here, and we all got a good chuckle until we got tired of listening to the same jokes every time they came visiting, because we all know it just doesn't work. I don't know if it's mainstream medicine's way of dipping their toe in the water, but you'd have to bathe in those, androgels and testims to get enough testosterone in your system, and it's all borne out by labs. I mean, you can see oftentimes I've seen guys that were using testim or androgel, and we see their initial labs, they'll have low T to begin with, and then if I ask them to not apply their gel before they, if they normally do it in the morning, before they do their labs, you'll see that their testosterone is now lower than it was before they started quote-unquote therapy. Why? It sort of acts like birth control does, where you give your body enough of the substance, the hormone, that it fakes it out, if you will, to say, oh, well, we don't have to produce any on our own, yet it only lasts for a short while, and guys that are naive to any other forms of therapy will think, oh, wow, I feel much better, relatively speaking, for a few hours anyway. But there's a reason why you have to apply it every day, because it's metabolized and your levels will drop back down again. And again, the effect is, overall, you might feel good for a few hours, but over a 24-hour period, you end up with a lower testosterone level than when you started.
Oh,
so, and 100 milligrams is not going to do the trick. If you got to 200 milligrams, you could probably get away with, definitely get away with the daily routine, depending on what kind of transdermal absorber you are, meaning how much of it you can absorb through the skin.
He wrote 10%. I don't know where he got that from, but do you agree with that? Or
maybe that's the average, but again, everybody's different. I've seen it vary by a factor of about 10. Some people, I've had them apply it double the typical dose twice a day, and because they're not absorbing through the skin, the levels don't bear out a significant absorption. So that again goes down to individual differences, but in general, 100 milligrams is not going to do the trick. That's just not enough.
Okay. So that question B of the same question, he was like, give me the pros and cons, injection versus you just answered it right there. I mean,
well,
pretty much.
Yeah, I mean, there's a huge difference clinically speaking between the two. And that's why I used to sort of ride the fence, and I've said I'm a registered libertarian, but I wouldn't try and give out my personal bias about using a gel or cream versus an injectable, but I just see so much more benefit with injections clinically that I can't bite my tongue anymore. And I really encourage most of my patients to use, even the women now, to use the injectable because, as I said, there's a reason why you have to use the cream every day. Your levels are going up and down, up and down.
Roller coaster, yeah.
And just real quickly, let's eliminate that argument about, well, that's more natural. Who cares? First of all, again, none of this is natural. It's
right.
natural to get sick and die one day, so who cares about natural? Right. Clinically, people who, when you're doing this on a weekly basis, you're going to have a peak if you're using cypionate roughly 2.5 days, and then a tail, and so your levels will be high for the entire week, and you'll feel better. And sometimes people will say, well, wait a minute, I know this is going to give me energy. I don't want to be energized all the time. Well, it's not like coffee. So we got to be careful we're not confusing the two. It's just the potential to have energy and, of course, feeling better all the time with levels that are consistently higher rather than variable as much as they are day to day with the cream.
I see. Okay. So he was saying if you want to build some real muscle, how much a week do you think is good? 500 milligrams? You can answer that by saying, I mean, at this point, it's just more to feel good. I mean, do you think they can actually use those gels to actually build muscle like you would with the injectable? Probably not.
Definitely not. Again, for the same reasons.
Okay.
And there are studies that go back to the 60s. I think one of which is listed on my nerdy website, but it was written by Jerry Brainham, by the way, showing that unless we got levels to at least 800 serum, we weren't going to see the clinical results. And that's borne out in my practice, watching people. If you're going to do this, you have to do it to get to a high normal level. To answer his question, 500 milligrams of testosterone a week.
Through gel.
Yeah, I mean, does that mean you're taking 2 days off, or it's 100 a day? That certainly would not be advisable, nor would that work to build muscle. Yeah. To some degree, the more the better, but there is a point at which you're going to definitely get diminishing returns. There's only so many receptors, etc. There are some studies showing that, and there aren't a lot because this isn't something we study in Western medicine now. There might be some in some Eastern European journals, and not necessarily the Eastern European journals of bad science. I mean, there's some real studies out there, but there aren't a whole lot showing that as much as 600 milligrams of testosterone in injectable form, like cypionate, is actually better for you than, say, 200.
Really?
Again, what's better, depending on what markers, but most of us agree that better to have more muscle. That's synonymous with more metabolism, if you will, higher metabolism, and therefore all kinds of good benefits that we all know about. But you're not going to see that in our country being practiced anytime probably in our lifetime, because it goes far outside the standard of care. And 200 milligrams a week of testosterone cypionate, again, everybody's different, but underneath that Gaussian curve, we're hitting 95%. Works very, very well to keep a mean high normal level of testosterone. And I mean, because of you have the swings,
right?
The mean is what you look at. And again, clinically, people are doing very well with that without any negative side effects. As far as that goes, not a question he asked, but to answer, what are the side effects that are possible?
Yes.
Typically, we look out for an elevated hemoglobin and hematocrit.
Acne?
Acne could be an issue, but that's not really because of testosterone. That's because of what testosterone can get converted into, something called dihydrotestosterone.
Gotcha.
But again, the elevated hemoglobin and hematocrit is usually not secondary to a disease process per se, or the excess testosterone directly, it's usually because someone's suffering from either sleep apnea, or they heavily snore, and therefore their oxygen saturation during their sleep goes down enough so that essentially they're training in their sleep. So you're creating a demand to create more red blood cells, more hemoglobin, things that carry oxygen in the system. And of course, the major one that we look out for is the elevated estrogen levels, because estrogen is made from testosterone. So whether you're using 100 milligrams of test gel, or 200 milligrams or 600 milligrams a week of testosterone cypionate, the fly in the ointment is estrogen. Estrogen is what causes the water retention, the fat retention, the moodiness and irascibility, and it activates the genes, all of which we have, or all of us carry, for prostate cancer.
So what would you say is the best thing to take to avoid that, to avoid having too much estrogen for a guy?
Well, my favorite, because I think it's the most elegant way of doing it, is to use an aromatase inhibitor, because that way you're sparing the very thing you're trying to replace, testosterone, by not letting it convert into estrogen. It's converted in the liver by this aromatase enzyme, and we just block that enzyme, and we can limit pretty easily and pretty precisely the amount of estrogen we produce.
So what would you prescribe then? What is it? What's it called?
The brand is Arimidex.
That's the best. So that's the one you like. Gotcha. Yeah. So that's the one you like the most.
We can block the receptor, but then we're still with something like tamoxifen, but then we're still creating the estrogen, and so your testosterone levels are going to drop.
I see.
Estrogen is going to be free floating, and I'm not sure that you never know. We might not have identified all the estrogen receptors out there, and there may be a mechanism by which something's not being blocked. Who knows? It's just, as I said, it's so much simpler, and to me more, maybe elegant's not the right word, but just it seems more intelligent to do it by blocking the conversion to begin with. Yeah,
that's great. All right, thank you, Doc. I want to expand a little bit on the last question, Doc, because I think the reason why people are asking about androgel and all those alternate way of getting tests aside from injections, because they're so afraid of the needle, and they just don't want to go there. So I think that last question was basically, please tell me test gel is good. Please tell me I can use it.
Sorry,
it's just as good. And so I think you'll be disappointed. So what do you have to say to the patient that come to you and say, please don't tell me I have to shoot myself. I don't want to use needle. What can you tell them to make them feel better?
First thing is, don't shoot the messenger. But everyone white knuckles it the first time. I don't care how macho you are, because since we're this high, nobody likes needles, right?
Right.
I tell people I was an accountant long before I was a doctor, so I'm honest and conservative as the day is long, right? No one, once they get around to shooting themselves with a needle, says, oh my God, I can't do that anymore, or wow, that hurt. In fact, everyone says, wow, that was it? That was nothing. So I really have just a handful of patients using the cream versus injection, because I really push for it because of the clinical benefits. What was the other part?
You were talking about cost, the fact that,
right. The other factor is it's so much cheaper and so much less of a headache. With creams, you have to apply them every day, and you have to remember, hey, I'm going to Vegas for the weekend. If you forget it, then you're 4 days without your cream.
Bring my stash.
And it's just a hassle. Plus, the practical parts of it, to be very frank, guys meet a girl that, again, going back to Vegas, and they don't feel comfortable bringing the cream with them, having to hide it in the bathroom or whatever. If they've already done their shot for the weekend, they don't have to worry about that sort of thing. But also the cost, practically speaking, is a huge difference. The creams, I don't know what the non-compounded versions like Androgel and Testim actually cost, but I know they're expensive. I've heard estimates of hundreds of dollars a month. I don't know. That's without the copay, but even the copay, I think you pay a good amount. Whereas, of course, depending on where you go, you can get testosterone cypionate, or the injectable therapy to which I refer, including your anastrozole and everything, for less than $100 a month.
Including the anastrozole. Why? Yeah. Wow.
So there's no reason why you're stuck with the Testims and the Androgels, because of price, certainly.
Gotcha. Thank you, Doc.